hello everyone. My name is Rauda. So today I'll be discussing a case of a patient who had presented to our clinic. So he's a 7-year-old boy with Down syndrome. He presented due to a school screening which was done in his school, which noticed a decreased vision in the right eye. He was, of note of past medical history, he was diagnosed with acute lymphoblastic leukemia and had recently achieved remission 5 months ago after completing his chemotherapy treatment. So on examination, of note that we could see the right eye, his vision was 20/50 with Cardiff cards, and the other significant finding was on the optic disc had optic disc edema, and the disc was white with hemorrhages and blurred margins, and I'll show you the image now, as you can see. So complete obliteration of the margins with disc hemorrhage. So at this point, we were wondering this could be a recurrence of the ALL. So we referred him to the oncology team to do an LP and a bone marrow biopsy, which they did, but it came back negative. So he returns back to us with a question from the oncology team whether we could do an optic nerve biopsy to make sure of the diagnosis. So this is the dilemma. What do you do when there's a high incidence of suspicion of recurrence of ALL, but the oncology team wants to do an optic nerve biopsy? Do you do it or not? And
I don't think you do any optic nerve biopsy, but this is a recurrence of his ALL, and this kid is going to go blind unless you can urgently treat those optic nerves.
yeah,
And one of the treatments might be radiation treatment.
exactly.
Many years ago when I was in Canada, I remember reviewing a whole series of kids with ALL, and many of them were going blind from delayed optic nerve treatment. And this kid, I think, needs radiation if you want to save his sight or protect it or improve it or hold on to what he has.
So this is his fundus photo after 1 month, and at this time they repeated the lumbar puncture and bone marrow biopsy, which came back positive for blast cells, and then he received the radiation treatment at that time. So a summary of this case was, this is a 7-year-old boy with Down syndrome who has a diagnosis of ALL but achieved remission, and then presented to our clinic with right optic disc infiltrate. So it's basically, how do you manage this case when the oncology team themselves are not agreeing with your management?
Or you override them.
You override them,
I think
yes.
you have to be very clear with them that it's not an option.
Yes,
And
exactly.
that they can't ignore it. Is there a role for systemic treatment, presumably, as well as the radiation?
There is,
Yeah.
I think, yes.
Yeah.
Yeah.
Okay, thank you.
Hi.